great deal of attention has focused on the struggles that patients faced during the COVID epidemic. Breslow and colleagues cast a new light on the COVID epidemic as it affected physicians and other healthcare providers in the United States. They examine relations between the demographic backgrounds and the experiences of healthcare providers and the psychological problems that these providers endured. And much like research on patient populations, these new findings on healthcare providers suggest the need to increasingly focus on groups who have traditionally been underserved. Just like the patient populations we see, as providers, we must attend to our colleagues who might be in need of help and who might not have had the opportunities to get the services that they very much deserve. Epidemiologic studies have generated great interest in the idea of resilience among children. And this idea is that certain characteristics of a child might protect them when they're exposed to risk factors for psychopathology. Copeland and colleagues cast a new light on this phenomenon of resilience, and they're able to do this by using data from a very carefully performed longitudinal study that now has extended through the third decade of life among these children. The important new finding is that risk factors can exert their relations with psychopathology in a relatively slow and incremental fashion. And due to this slow association between risk factors and psychopathology, we must be careful when we're evaluating a child who is entering adulthood before we consider them resilient. Copeland and colleagues suggests that many children who might appear resilient without any signs of psychopathology through their teen years, in their 20s, might ultimately face a higher risk for psychopathology. And this should alert clinicians to the importance of carefully monitoring all children, even those children who are doing well initially, who are exposed to risk factors for psychopathology.